When we do weight loss surgery, it's a lifetime change. And for a lifetime result, sometimes you have to tweak it or adjust it as time goes by. If you have gallbladder removed or an appendix removed, well, that's a permanent change. It's not coming back. But if you have weight loss surgery for a lifelong change, sometimes down the road, 5 or 10 years, you may need an adjustment. And I think weight loss surgery is very challenging. A lot of groups don't want to tackle that project, but we think it's great here at Surgical Specialists of Louisiana because we feel confident in our skills, and we do a lot of revisional surgery for our patients. When the patients have dieted their whole lives and then they have surgery for weight loss, they often think that's the last step. I can't do anything after that. But the truth is, nothing is 100%. Most procedures are about 90% effective. So there's always some patients who may need a little something afterward. And that's why we offer revisional surgery to our primary patients. You've tried hard with your current procedure and you've done pretty good, but now you're having some trouble. And when we do the revision, usually the switch is turned on and you get that result you've been looking for with the new procedure. So once we decide we're going to do a revisional procedure on you, usually the stay in the hospital is overnight, sometimes it's 2 days. And we watch you close because anytime you redo surgery on an area that's had surgery before, there's a little bit higher chance for infection or bleeding, but we've had really good results. So we keep you overnight, and usually it's still done laparoscopically. Even if your first procedure was done open with the big incision, we'll use the laparoscope and the small incisions, and that gets you up and around faster, gets you home usually in a day or 2. So the experience is very similar to the current 21st century weight loss surgery procedures that we do every day. One of the big questions with revisional surgery is, will my insurance cover it? And most of the time the answer is yes. What the insurance companies are looking for is, number one, are you having a problem? Are you having bile reflux? Do you have slipped band? Do you have ulcers? And if those sort of medical problems come up, oftentimes insurance will cover that. Also, for weight loss, if you've had a procedure and you've lost some weight but you're still morbidly obese, frequently the insurance companies will cover that procedure also. Because the goal is to get you healthier and happier, and the insurance companies look at all those problems, and if it works with their system and with your plan, then most of the time insurance does cover it. If not, we do have cash pricing for those procedures, but first we try your insurance.